الله الرحمن الرحيم. طلبتنا الأعزاء، أني الدكتور الاستشاري علي عباس الموسوي، استشاري لجراحة الدماغ والأعصاب والعمود الفقري، تدريسي في كلية طب حمورابي. محاضرتنا لهذا اليوم للمرحلة الثالثة عنوانها Cranial Nerves and Autonomic Nervous System. Objective of our lecture to understand the organization of cranial nerves with respect to their nuclei within the brain, their course through and exit from the brain, and their functional and clinical rules, and to recognize the function and difference between the parasympathetic and sympathetic nervous system, and be able to link the various parasympathetic ganglia with their cranial nerve counterparts. We have 12 cranial nerves, all contribute to innervation of the skin, viscera, and the muscle of the head and neck. Nerves derived from the cervical plexus innervate a portion of the skin of the region. It is essential to understand the cranial nerves that can distribute not only sensory and motor fiber, but also autonomic nerves involved with special sensation like vision and taste. The first of the cranial nerve is called the olfactory nerve, which is distributed to the uppermost part of the nasal cavity and is concerned with the sense of smell, contain only special sensory fibers, and reach the nose by the cribriform plate of the ethmoid, and the fracture of the ethmoid can cause dural matter damage and associated with the leakage of the CSF from the nose. The second cranial nerve is the optic nerve, responsible for transmitting the special sensory information for the vision and considered a part of the central nervous system, and the examination of the nerve enables us to assess the intracranial health. The course of the optic nerve can be divided into the extracranial, which means extra outside the cranial cavity, and intracranial component. The nerve leaves the bony orbit by the optic canal through the sphenoid bone and enter the cranial cavity, running along the surface of the middle cranial fossa in close proximity to the pituitary gland. Within the middle cranial fossa, the optic nerve from each eye unite to form what's called the optic chiasm, and the fiber from the nasal or medial half of each retina cross over the contralateral optic tract, while the fiber from the temporal lateral half remain ipsilateral, as it's obvious in this picture. We have left optic tract and right optic tract. The third cranial nerve, called oculomotor nerve, and enter the orbit via the superior orbital fissure and innervate the extrinsic eye muscle, except the lateral rectus muscle and the superior oblique. It originates from the midbrain and is a mixed cranial nerve containing motor and parasympathetic nerve fibers. The general somatic efferent fiber of the oculomotor nerve supply the levator palpebrae superioris and a four of the 6 extraocular muscles, the medial, superior, and inferior recti and inferior oblique muscle. The third cranial nerve also convey preganglionic parasympathetic fiber to synapse in the ciliary ganglion, which then provide postganglionic parasympathetic fiber to intraocular muscle, enabling the pupillary constriction and accommodation. This is picture demonstrates the anatomy of the oculomotor nerve from the brainstem and the supply of the extraocular muscle. The trochlear nerve, called the fourth cranial nerve, is a motor nerve, innervate only the single muscle, which is the superior oblique muscle. It emerges from the posterior aspect of the midbrain, and the nerve travel in the lateral wall of the cavernous sinus and enter the orbit via the superior orbital fissure. The fifth cranial nerve, called trigeminal nerve, is the greatest nerve of the head and neck, divided into the 3 divisions: ophthalmic, maxillary, and mandibular nerve. The first 2 are entirely sensory, but the mandibular nerve also contains motor fiber which innervate the muscle of mastication. The large sensory root and the smaller motor root leave the bones, and the motor root is distributed to the muscles of the mastication, mylohyoid muscle, anterior belly of the gastric. And the mandibular nerve also innervate the tensor villi palatini and tensor tympani muscle. This is a picture showing the division of the trigeminal nerve. Also the innervation of the face according to the mandibular division, maxillary, and the ophthalmic division. We have clinically assessed the function of trigeminal nerve by the corneal reflex, by the testing the sensory component of trigeminal nerve and the motor component of the trigeminal nerve. The trigeminal nerve may be injured by trauma, aneurysm, or meningeal infection, and the injury may cause paralysis of the muscle of the mastication, loss of ability to appreciate tactile, thermal, or painful sensation in the face, cornea conjunctiva, and the loss of the corneal reflex. The sixth cranial nerve is called abducent nerve, arising from the abducent nucleus in the bones of the brainstem, and it exits the brainstem at the junction of the bones and the medulla, and within the bony orbit, the abducent nerve terminates by innervating the lateral rectus muscle. The seventh cranial nerve is called the facial nerve. It's a complex nerve as it contains motor, general, and special sensory and parasympathetic fiber. This is the division of the facial nerve as it leaves the skull. We have 5 nerve branches: temporal, zygomatic, buccal, mandibular, and cervical, with the muscle innervation. The 8th cranial nerve is called vestibulocochlear nerve. It is known as the auditory vestibular to transmit the sound and equilibrium information from the inner ear to the brain. The 9th cranial nerve is called the closopharyngeal nerve, exits from the medulla oblongata, contain 4 types of the nerve fiber: motor fiber to the stylopharyngeus muscle, parasympathetic fiber to the parotid gland, fiber of special sensation to the posterior third of the tongue, and general sensory distributed to the pharynx and oropharyngeal, isthmus, dorsum of the palate, and the auditory tube. And finally, by its sinus branch, supply the carotid sinus and carotid body that monitor blood pressure and arterial oxygen level respectively. The 10th cranial nerve is called the vagus nerve, which has enormous territory extending into the abdomen. In the head and neck, it's sensory to the lower part of the pharynx. It supplies taste fiber to the taste bud associated with epiglottis, and sensory to external auditory meatus and the bulb of the auricle. The accessory nerve is 11th cranial nerve, has a cranial part and the spinal part. It innervates the sternocleidomastoid and trapezius muscle, and current evidence suggests that the spinal root contains both sensory and motor fiber. It passes through the jugular foramen. And the last cranial nerve is hypoglossal nerve, is the motor supply to all the muscle of tongue, with the exception of palatoglossus. Some cervical nerve from C1, 2, and 3 are looped onto the hypoglossal nerve, forming the ansa cervicalis. The hypoglossal nerve supplying we have extrinsic and intrinsic muscles responsible for vast majority of the muscle of the tongue, as in this picture. This is the base of the skull with the foramina passing through it the cranial nerves. We have autonomic nervous system for the head and neck. We have the sympathetic system, and the action of the sympathetic nervous system are associated with the fight and the flight response. The sympathetic fiber to the head and neck begin in the spinal cord, and they originate from the thoracic T1 to T6, and therefore need to ascend to read the structure in the head and neck. And there are 3 ganglia within this chain that are of interest: superior, middle, and inferior cervical ganglia. We have superior cervical ganglia, middle cervical, and inferior cervical ganglia. This picture showing the function of the sympathetic and the parasympathetic autonomic nervous system. We have in clinical relevance a Horner syndrome. The sympathetic fiber can be stretched or damaged along the course of the head and neck. If these nerves are unilaterally disturbed, it will produce a triad of main symptoms known as Horner syndrome: partial ptosis, meiosis, and anhidrosis. This picture showing the cervical ganglia, which is the superior, middle, and inferior, and relation to the arteries and the effector organs. The parasympathetic innervation of the head and neck. The action of parasympathetic are associated with the rest and digest response, and there are 4 pairs of parasympathetic ganglia: ciliary ganglion, pterygopalatine, submandibular, and otic ganglion. In this picture, showing the ganglion of the sympathetic and parasympathetic autonomic nervous system. We have pterygopalatine, submandibular ganglion. The parasympathetic fiber from the vagus supply the gland of the larynx. Injury to the sympathetic trunk or ganglia can result in the following disorder: pupillary constriction, ptosis, and the flushing of the face, and the lack of the sweating. And thank you.